Narration: children's non-aspirin is used to treat mild to moderate pain such as headaches, menstrual periods, toothaches, backaches, osteoarthritis, or cold/flu aches and pains. It is also used to reduce fever. The recommended daily dosage for children varies based on their age and weight, so be sure to follow the instructions on the packaging or as directed by your healthcare provider. It is best to take this medication with food or milk to help prevent stomach upset. It is important to not exceed the recommended dosage, and always consult with a healthcare provider before giving this medication to a child. The optimal timing for taking this medication may vary depending on the specific condition being treated, so be sure to follow the directions provided. When taking children's non-aspirin, follow the directions on the package and consult your doctor or pharmacist if you have any questions. Make sure to use the right product for your child's age and weight, and measure liquid medication with the provided tool. Pain medications work best when taken at the first signs of pain, and do not take this medication for fever for more than 3 days unless directed by your doctor. If your child has a sore throat with high fever, headache, or nausea/vomiting, consult the doctor promptly. If your condition worsens or you develop new symptoms, seek medical help right away. If your child experiences any unusual effects from using children's non-aspirin, it's important to contact your doctor or pharmacist right away. However, most people do not experience any serious side effects when using this medication. While it's rare, a very serious allergic reaction to children's non-aspirin can occur. If you notice symptoms such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Remember, always follow your doctor's directions for the proper use of children's non-aspirin, as they have determined that the benefits outweigh the potential risks. If you have any concerns, don't hesitate to reach out to your healthcare provider for guidance. Too much acetaminophen can cause serious liver disease, and adults should not take more than 4,000 milligrams, 4 grams, a day. People with liver problems and children should take less. Ask your doctor or pharmacist for the safe amount. Don't use with any other drug containing acetaminophen without asking your doctor or pharmacist first. Acetaminophen is in many non-prescription and prescription medications. Check the labels and ask your pharmacist if you are unsure. If you take too much acetaminophen, get medical help right away, even if you feel well. Symptoms of overdose may include nausea, vomiting, loss of appetite, sweating, stomach pain, extreme tiredness, yellowing eyes/skin, and dark urine. Daily alcohol use, especially when combined with acetaminophen, may damage your liver. Avoid alcohol. Before giving children's non-aspirin to your child, it's important to consider a few things. First, if your child has any allergies, especially to acetaminophen, make sure to talk to your doctor or pharmacist. This medication may also contain inactive ingredients that could cause allergic reactions, so it's important to discuss this with your healthcare provider. It's also important to let your doctor or pharmacist know about your child's medical history, especially if they have liver disease or if they regularly use or abuse alcohol. If you're considering using the liquid, chewable, or dissolving/effervescent forms of children's non-aspirin, it's important to note that these products may contain sugar or aspartame. If your child has diabetes or phenylketonuria, PKU, or any other condition that requires them to limit or avoid these substances in their diet, be sure to speak with your doctor or pharmacist about using these products safely. If your child is pregnant or breastfeeding, it's important to consult with a doctor before using children's non-aspirin. It's important to note that children's non-aspirin may interact with other medications and potentially cause serious side effects. Always keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug are ketoconazole and levoketoconazole. Additionally, this medication may interfere with certain lab tests, which could lead to false test results. It's crucial to inform lab personnel and all your doctors that you are using this drug. Remember to always follow your doctor's instructions and guidelines for taking this medication. If someone has taken too much children's non-aspirin and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the US, you can call the local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Symptoms of an overdose may include nausea, vomiting, loss of appetite, sweating, stomach or abdominal pain, extreme tiredness, yellowing eyes or skin, and dark urine. If you suspect an overdose, it's crucial to seek help right away. Unlike NSAIDs like aspirin, ibuprofen, and naproxen, acetaminophen does not cause stomach and intestinal ulcers. But it also does not reduce swelling like NSAIDs do. It's best to consult your doctor for more details and to see which medication might be right for your child. Children's non-aspirin can help reduce fever and relieve minor aches and pains due to colds, flu, or other minor viral illnesses. The recommended dosage for children is based on their weight, and it's important to follow the dosing instructions carefully. It's best to give the medication with food or milk to help prevent stomach upset. And always make sure to give the right dose at the right time, according to your doctor's instructions. If your child is taking children's non-aspirin on a regular schedule and misses a dose, they should take it as soon as they remember. However, if it is close to the time of the next dose, they should skip the missed dose and take the next dose at the regular time. It's important not to double the dose to make up for the missed one. Always stick to the recommended dosage schedule to ensure the best results. When it comes to storing children's non-aspirin, it's important to keep it at room temperature and away from light and moisture. Make sure to store it in a place that's not in the bathroom and out of reach of children and pets. When it comes to getting rid of any leftover or expired children's non-aspirin, make sure to not flush it down the toilet or pour it into a drain unless instructed to do so. Instead, you'll want to properly discard it by consulting your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.